Tinnitus. As an audiologist, I was trained to identify, diagnose, manage, and treat disorders of the inner ear. One of the most common disorders that I help treat and manage is called tinnitus or tinnitus. Tinnitus is commonly described by my patients as a ringing or buzzing in their ears, and it can vary from low or high pitch. The noise can be present in one or both ears, and it may be constant or intermittent. Tinnitus is a common problem affecting over 50 million Americans, according to the American Tinnitus Association. It can be caused by a number of health conditions, such as ear and sinus infections, hormonal changes in women, brain tumors, head injuries, diseases of the heart or blood vessels, noise-induced hearing loss, Meniere's disease, and thyroid abnormalities. Most often, however, tinnitus is not a sign of a serious health-related issue, but if the noise is loud or prolonged, it can affect concentration and cause emotional turmoil. Like I tell my patients, if you are suffering with tinnitus, it is important to understand the cause and what you can do about it. There are 3, but not limited to, causes of tinnitus. The first is hearing loss. 90% of people who have sensorineural hearing loss also report tinnitus. This form of hearing loss is natural and tends to be bilateral or in both ears. If you're noticing that you're unable to hear some high-frequency sounds, you may have age-related hearing loss, a type of hearing loss that's sometimes accompanied by tinnitus. Second is noise-induced hearing loss. Tinnitus can be caused by noise-induced hearing loss. It will develop after being exposed to noise over a period of time. People who work in factories or construction sites who go to a lot of concerts may develop this type of hearing loss. Such noisy environments can slowly damage the tiny sensory hair cells in your inner ears that transmit sound to the brain, resulting in hearing loss and ringing in the ears and other sensations. Traumatic brain injuries. Another common cause of tinnitus are TBIs. Motor vehicle accidents, falls, and assaults can damage the brain and cause the sensation of ringing or buzzing within the ears. Even if the brain injury did not cause the tinnitus, there are some medications used to treat the cognitive problems that are associated with the development of tinnitus. This type of mild TBI most often affects active duty members. In fact, according to an article published by the Military Medicine, U.S. military members have 32.3% prevalence from all causes and can be linked to PTSD as well. Well, how do we treat? Many times those who suffer with tinnitus assume that there's nothing that can be done to alleviate their symptoms. This is not true. If you are experiencing a loud or constant cause of tinnitus, you should seek a professional assessment. Audiologists, like myself, are trained to understand and recommend solutions for many hearing-related problems. Although no available treatment can entirely cure tinnitus, certain management techniques can be used to lessen their effects. These techniques can include retraining therapy, tinnitus activity treatment, cognitive behavioral therapy, and other psychologically based approaches. The amplification of hearing aids may even work to reduce the ringing in a person's ears. To determine which treatment method works best for you, come in to see us.